Have you ever wondered how dental implants work? It's a fascinating blend of science and artistry that transforms lives by replacing missing teeth. Dental implants are essentially artificial tooth roots, typically made from titanium, that provide a strong foundation for fixed or removable replacement teeth. They're designed to blend in with your natural teeth, and more importantly, they offer the durability and stability needed to eat, smile, and speak with confidence. They're not just about aesthetics, though. Dental implants also play a crucial role in maintaining oral health by preserving the jawbone and preventing the shifting of remaining teeth. So it's not just about getting back your smile, it's about getting back the quality of life. In this video, we'll be diving into the intricate process of dental implants, breaking it down into understandable steps. From initial planning to the final placement of the artificial tooth, we'll guide you through each stage of this transformative procedure. Stay tuned as we explore the fascinating process of dental implants. The journey to a new smile begins with planning. And indeed, like any worthwhile journey, getting dental implants is a process that requires careful and thorough planning. This phase is crucial in ensuring the success of the implant procedure and your overall oral health. First things first, it all starts with a comprehensive dental examination. This isn't your ordinary dental checkup, oh no. This involves a full sweep of dental exams, including x-rays and three-dimensional imaging, to get a complete picture of your oral health and structure. This vital step allows dental professionals to assess the condition of your jawbone, the positioning of your teeth, and other important factors that could affect the procedure. Now, you might be wondering who exactly is involved in this process. Well, it's not a one-man show. A team of specialists typically collaborates in this phase. You may have oral surgeons, periodontists, and prosthodontists all working together to create a treatment plan that's tailor-made just for you. Each specialist brings their unique expertise to the table to ensure that every aspect of your implant procedure is meticulously planned and executed. Another important facet of the planning phase is the review of your medical history. This might seem like a routine step, but it's far from it. Your medical history can reveal potential risks and contraindications that could affect the safety and efficacy of the implant procedure. This includes conditions like diabetes or heart disease, habits like smoking, and even the medications you're taking. All these factors are carefully considered in the planning phase to ensure that the implant procedure is safe and suitable for you. So yes, the planning phase of a dental implant procedure might be quite involved, but it's all for a good cause: your smile. It's about making sure that the journey to your new smile is safe, successful, and specially designed to meet your unique needs. Once the planning is complete, we move on to the next phase. But remember, the path to a perfect smile is a journey, not a race, so let's take one step at a time. The next step involves making room for your new tooth. We commence this phase with tooth removal if necessary. Damaged or decayed teeth are gently extracted to clear the space for the forthcoming dental implant. Now, one might wonder, why is it essential to remove these teeth? Well, to ensure the long-term success of the dental implant, it's crucial to start with a clean, healthy foundation. Moving on, we have the jawbone preparation. This is an integral part of the process where the jawbone is readied to receive the implant. But not all jawbones are the same. Some might lack the necessary density or thickness to hold the implant securely. In such instances, a procedure called bone grafting comes into play. Bone grafting, in simple terms, is the process of adding more bone to your jaw. Think of it as creating a stronger and more solid foundation for your new tooth. This bone could be sourced from another part of your body, like your hip or chin, or it could be synthetic. Regardless of the source, the goal is the same: to ensure that the implant has a robust base to anchor onto. After the graft, the jawbone needs time to heal and grow new bone. This healing period can vary significantly, from a few months to a year, depending on the individual and the extent of the grafting done. Patience here is key. We're setting the stage for a dental implant that will not only look natural, but also feel and function like a natural tooth. So, to recap, this stage involves tooth removal, if required, and jawbone preparation, which may include bone grafting. These steps are crucial to ensure that the implant has a strong, healthy foundation to anchor onto. This meticulous preparation plays a significant role in the long-term success of the dental implant. With a prepared jawbone, we're ready for the implant. The upcoming steps will involve placing the implant into this patient's carefully prepared groundwork. Stay tuned as we continue to demystify the journey towards your new, radiant smile. Now comes the exciting part: placing the implant. This is where we transition from preparation to the actual process of implantation. The implant, typically fashioned from titanium for its durability and compatibility with the body, is all set to create a new home in your jawbone. So, how does this process unfold? It all starts with a precise incision in the gum to expose the bone. This is done with utmost care and precision, ensuring minimal discomfort. Following this, our specialist drills small holes into the bone. These holes are carefully mapped out and prepared to accommodate the implant perfectly. Once the preparation is complete, it's time to place the implant. The titanium implant is gently inserted into the drilled hole, nestling in the bone socket of the missing tooth. Think of this implant as a new root, a strong foundation for your soon-to-be new tooth. But the magic doesn't stop here. Over the coming weeks and months, something remarkable happens. Your jawbone starts to heal around the implant, a process known as osseointegration. This is your body's way of accepting the new implant, enveloping it securely within the bone structure. With the implant in place, it's time to connect the dots. Now that the implant has had time to become one with your jawbone, we move on to the next key stage of the dental implant process: attaching the abutment. The abutment is the unsung hero of the dental implant procedure. Think of it as the middleman, the bridge that connects the implant securely embedded in your jawbone to the crown, which is the part of the tooth you see when you flash that beautiful smile. It's the abutment's job to ensure that the implant and artificial tooth can work together seamlessly. So, how is the abutment attached to the implant? Well, it's a precise and careful process. We start by reopening the gum tissue to expose the implant. This is done gently and meticulously to ensure the area remains clean and safe. With the implant now visible, the abutment is then attached. The process of attaching the abutment involves screwing it onto the implant. This is done with great precision and care, as it's essential that the abutment is secure and positioned correctly. It needs to be sturdy enough to hold the crown, the final piece of the puzzle, which will undergo the pressures of daily activities like eating and speaking. Once the abutment is attached, the gum tissue is then closed around it. This leaves a small part of the abutment visible above the gum line. Don't worry, it's supposed to be that way. This visible part of the abutment is where the crown will eventually be attached. Now, it's worth mentioning that in some cases, the abutment may be attached during the initial implant placement. This depends on a variety of factors, including the specific treatment plan and the patient's individual circumstances. But whether it's done in the initial procedure or in a separate one, the goal remains the same: to create a strong and reliable connection between the implant and the soon-to-be attached artificial tooth. And there you have it. The abutment is now in place, acting as the crucial link between the implant and what will soon be a shiny new tooth. The abutment is ready and waiting for its crown. Finally, we reach the crowning moment. We've journeyed through the meticulous process of planning, tooth removal, jawbone preparation, implant placement, and attaching the abutment. Now it's time for the grand finale, the placement of the artificial tooth. This isn't just any tooth we're talking about, it's a masterful creation, custom designed to match the shape, size, and color of your natural teeth. Each artificial tooth is a work of art, painstakingly crafted to provide a seamless and aesthetically pleasing result. How does this happen, you might wonder? Well, it begins with taking precise measurements and impressions of your mouth. This is done to ensure that the artificial tooth will fit perfectly within the unique landscape of your oral cavity. Then, using these measurements, dental technicians labor over creating the perfect replica of a natural tooth. They use high-quality materials that not only look like real teeth, but also feel like them. They sculpt, they shape, and they color until they've got an artificial tooth that's almost indistinguishable from a natural one. Once this masterpiece is ready, it's time for the final step, attaching the artificial tooth to the abutment. This is done carefully to ensure that the tooth is securely fastened and will not shift or move. The moment the artificial tooth is in place, it's as if magic has happened. There in the mirror is a new tooth that fits in perfectly with the rest. It doesn't just look like a natural tooth, it feels like one too. It restores function, allowing you to bite, chew, and smile just like before. And the best part, it's designed to last. With proper care, This new addition to your smile can last a lifetime. It's more than just a replacement, it's a long-term investment in your oral health and your confidence too. And there you have it, a new tooth that looks and feels just like a natural one. So how do dental implants work? Let's recap the journey we've just taken. The process begins with careful planning involving comprehensive dental exams and collaboration among specialists. Then comes the preparation stage, where necessary tooth extractions and jawbone preparations are carried out. The actual implant placement is a procedure where the titanium implant is surgically placed into the bone socket of the missing tooth, serving as a substitute for the natural tooth root. In some cases, a bone graft may be necessary to augment the jawbone, ensuring it can support the implant properly. Once the implant has fully integrated with the jawbone, an abutment is attached, serving as a connector between the implant and the artificial tooth. Finally, the artificial tooth is attached, restoring both function and appearance. This journey may span several months, but the result is a durable, natural-looking tooth. Thanks for joining us on this journey through the process of dental implants. Here's to your healthy and beautiful smiles.